Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hi, everyone. Welcome to another episode of the Vitality Vault Podcast. And today we'll be continuing in our series of primary care common conditions. All right. So I'm Dr. B, and over here we've got Dr. G.
That's me, live and in living socks.
Yes, with a new sock today to introduce to you guys.
Yes, this is my coffee socks. I love this one.
Very fitting.
As you can see, there is a bit of Frappuccino here. I have my Cappuccino here. So these are my coffee socks, which I tend to wear on certain days. And today it's quite a special day because today we're talking about a special condition. And Dr. B will lead us off, but coffee can help or hurt this condition.
True. We're going to be talking about migraines.
Ouch.
All right. Affects a lot of us, actually. Most headache disorders are classified as migraines. So we're going to be focusing on migraines because even if it's stress-related headache, tension, sinus headache, can actually evolve into a migraine. So let's talk about the pathophysiology of migraine, definition, what to look out for, what can help, etc. And as Dr. G said, coffee can actually help or hurt when we're talking about headaches, and we'll talk a little bit more about that too. So let's look at the definition here. So migraines are neurological disorders that cause recurring headaches. So it's not just one headache. It's usually a series of headaches before the diagnosis of migraines come about. And they can happen with or without what we call an aura. So the mechanism of the actual headache happening it's very complex. It's not very definitive, but it's a complex interplay of what we call the trigeminal-vascular system, which is made up of a bunch of blood vessels and nerves. And it also involves a lot of neurotransmitters that go through different changes in the brain when scientists study the onset of a migraine. Common symptoms are, so migraines typically present as throbbing pain. Typically one side is triggered more often than the other. Most patients complain of nausea, light and or sound sensitivity. They need to go lie down in a really dark, quiet room. And fatigue can absolutely be part of that syndrome as well. Now, some people have what we call a prodrome prior to having a migraine. That's usually like a craving for sweets or chocolate, something not really in the good food category. And some people have mood changes as well, too. So they kind of know that, I'm getting close to a headache. Now, auras are actually things that are not normal, but they can precede a migraine. And we'll talk a little bit more about auras in just a bit. And then typically you'd have a prodrome, an aura, and that's followed by that headache phase where you have those symptoms that we just spoke about: throbbing pain, nausea, light and sound sensitivity, etc. And then most major migraines are followed by a postdrome where you feel just lack of energy, you're achy, you just want to lie down. You don't want anyone to talk to you, basically.
Oh, yes.
Difficulty concentrating. So, some of these symptoms can last for days, not just one day. But migraines can last up to a week, actually, with just that one onset when you think about the prodrome, the headache phase, and the post-headache phase, just not feeling yourself, not feeling well. So, when we're talking about types of migraines, typically there's with and without aura. So we talked a little bit about aura up there preceding the migraine. Auras are things such as these flashes of lights that you may see in your vision. You may see these little zigzag lines or blind spots. Some people even get a little tingling, like in certain areas of their face, or a numbness that precedes the headache. And the migraines with auras are referred to as complicated migraines because those symptoms can actually lead eventually into stroke-like symptoms. So we need to be very careful about how many of these auras we're triggering. Without aura really means that there's no aura signs. You could still have a prodrome, but no blind spots, no visual disturbances. Chronic migraines classified as more than 15 headache days per month. So pretty much for
more than half
most
the
of
month.
the month.
That's half the month.
Yeah. And, a lot of people do suffer from that. So diagnosis is usually a clinical evaluation, of course, ruling out other causes. So you'd have different workup, would it be blood work, brain imaging, just to rule out other causes. And if everything else is, you fit the clinical picture of a migraine, then that's where the diagnosis comes in.
So with regards to migraines, I know you have a personal experience, Dr.
Oh,
B,
yes.
with migraines. So just for the public, how old were you when you had your first migraine?
I remember that very vividly. I was 14 years old. Absolutely. And I have migraines with aura. So my aura, actually, I lose peripheral vision. So I start seeing blind spots on the sides. And eventually, if I don't seek help, if I don't go lie down or take something for it, I can get to that pinpoint vision, and it can be really scary. But yes, from the age of 14. So I definitely identify with my patients when we're talking about migraines because there's some things that I've done that has definitely helped. And so I like to pass that on because not everybody's migraine is the same. Mm-hmm. Everyone has a different trigger. Mm-hmm. Everyone responds to different medications and different treatments differently. So you have to figure out what your triggers are actually if you're suffering from migraines because it's not a one fit all.
No. And funny you mentioned triggers. So what we like to do, and I know I do with my patients, is a headache diary. Yes. Meaning you keep a log. If it's beginning, you keep a log of what triggers the headache. You write down what you're doing at the time it happens. Mm-hmm. You write down what you took to make it go away. You write down what happens after it went away, how long it lasted. So really documenting or journaling for at least 2 to 3 weeks if it's very frequent. If you're in that I don't know what I have phase, keeping a good headache diary is actually good. Now, triggers, I have a story about a patient that I had who and this goes back to motivation. Had migraines. This guy is in his 50s. Had migraines for years, right? And I was tried him on different medications. And I thought he was doing everything right on his own to kind of get his headaches or understand what was going on. Until one day when I realized that, okay, we've tried like 3 different types of medications, still couldn't get a handle on it. And then this is what the patient told me. Oh, doc, whenever I do this thing, I have a migraine. And I was like, oh, okay. So, and for full disclosure, when he had a glass of wine at the end of the day, he'd have a migraine. He said without fail. So I remember sitting back going, oh, okay, cool. That's awesome. We figured out part of the puzzle. And I was like, okay, so then just don't have wine. That was in my head, mm-hmm. Dumb me, right? And he's like, I don't think I can do that. I was like, oh, okay. And then he goes on to say, that's how I unwind. So I was like, wait, so you're telling me that every single time you do this thing, you have a glass of wine, without fail, 100% of the time you end up with a migraine that puts you out for the next day, and you're not willing to quit it? No, I'll just take the medications. So point is, if you know what a trigger is or what your trigger is, please avoid the trigger, like Dr. B said, avoid the trigger. And to her point, especially for men, migraines are actually more of a detriment than they are for women, because the men who have migraines uncontrolled are at greater risk of strokes. So it is very, very important. If you know that this thing you're doing, whether it be eating a certain food, or or staying up too late, or staring at a screen for too long, please avoid the trigger. Figure out what it is, avoid it, because nothing is worth a migraine. I've never had one. I know. I mean, living in Dr. B, I've seen her go through them.
He lives with the migraine.
I thought she would say I am the migraine, but I'm happy. I'm happy with he lives with it. I'm happy with that. I'll take it. I thought she would say he is the migraine. So, but it's important to know your trigger, figure it out, and then avoid the trigger. Simple enough.
So let's talk about some risk factors here. So family history of migraines definitely increases your risk of you having migraines yourself, especially females. It's a very lot more females suffer from this than males. And we could see why by the next one. Hormonal changes actually can trigger a lot of this. So a lot of people have menstrual headaches. So during that last 2 weeks of the cycle, with the hormone changes, it could definitely trigger headaches, and migraines can be more frequent during that time. And pregnancy may worsen or improve it, actually. Yes, mine went away when I was pregnant completely, but came back like a beast after. So
they're called kids.
Long term.
What she means is, after the pregnancy, the migraines, we call them kids. That's what we call them.
All right, so some more risk factors. Sleep is a big one. You've got to make sure you're getting good, restful sleep. And weather changes, change in barometric pressure definitely can affect the brain and trigger the headaches. And dietary triggers include caffeine, alcohol, chocolate. Yes, all the good stuff. Actually, caffeine goes either way. So for people who are very caffeine sensitive, having a little bit of caffeine, whether it be coffee, tea, or a little piece of chocolate, dark chocolate preferably, would actually help the migraine. But on the other hand, if you're drinking, if you're that person that needs like multiple cups of coffee per day, that can actually trigger the migraine. So too much caffeine can trigger it, but if you're not a big caffeine person, a little bit of caffeine can actually help. There are actually some migraine meds that has a little bit of caffeine in it, because it's been clinically shown to help with the headaches. Some cheese as well too, especially the aged cheese. So be careful with that, especially when you get a craving for these things. It probably means that that's maybe a prodrome for your migraines.
So you're saying if you cut the cheese, you get a migraine?
I guess if you cut the cheese, I get a migraine.
I'm here all week, folks.
So let's talk about testing. So we want to make sure that we rule out the secondary causes. And typically, if it's a new onset migraine, I would order MRI or CT scan of the brain just to rule out any masses, any cysts, anything else anatomically that might be causing the headaches. We want to make sure that your blood pressure is under control, because high blood pressure can cause headaches. So we've caught a lot of that with patients coming in with headaches. We realize, okay, your blood pressure is not doing too good today. Also, like problems with, the eyesight changes. If you need new glasses, new prescriptions, that can also be a source of your headaches, your migraines. So we want to rule out all of those things that we could potentially fix to help with your headaches.
So let's talk treatment. So acute treatment, which is when the migraine hits, what do you do? Obviously, you start off with NSAIDs. The typical over-the-counter, some of the brand names are ibuprofen or Aleve, those you can do. Another good abortive one is the triptan. That's the Imitrex, the sumatriptans. Those are good ones to be on. And the newer ones you see on TV now, the CGRPs, which are blockers for the specific pathway, which can help improve the actual pain syndrome associated with a migraine. I think they work on a substance P level, which is a chemical that elicits the pain response. And you use other medications too. You can use anti-nausea medications for the nausea, and sometimes we end up using some muscle relaxants to help for those patients who have cervicogenic or neck related migraines, that's one option too.
Yeah.
Now, once you go on abortive, and that's what we always start abortive first to see if it helps. Once you realize, okay, the abortives are helping, but you're still having more than 15 headache days a month, then we have to go to more of the prophylactic or long-term treatment. And that's when we dive into the medications like the beta blockers, propranolol, old school, the anticonvulsants like topiramate, and even tricyclic antidepressants like nortriptyline, amitriptyline. The CGRPs also come in long-acting versions, which are typically injections as a newer class. And I've used these in the practice. And I know you have too, Dr. B. And these are actually, I think, a lot more efficacious for the controlling of the headaches. Now, for some patients, depending on the nature or the complicated nature, of the actual migraine syndrome that person has, they may need more than one chronic therapy on board, preventive therapy on board. They may need to be on the amitriptyline plus be on a CGRP long-acting just to be able to function. And that's just the nature of migraine headaches as we are still doing tons of research into it,
Yeah. I have people who are on 3 or 4 different things for prevention. There's even the new treatments of Botox for migraine.
The neuromodulators,
too. And so, like, some of them will be on one of the injections, like the Aimovig or one of the, same class. And they'll be on a pill, whether it be, something related to the CGRP inhibitors or whether it be the topiramate or nortriptyline, etc. And so they'll have 3 different modalities going on and still have their abortive therapy because there's always a breakthrough. Let's say you didn't sleep well, in one night. Or your stress level went through the roof one day, that could definitely be a trigger there. So we have different modalities to help to control that migraine syndrome and help to reduce the frequency of your headaches.
And of course, non-pharmacological. All these work really well, whether it's acupuncture, cognitive behavioral therapy, and also biofeedback mechanisms where it just helps you kind of manage those symptoms. Now, let's dive into my favorite, supplements.
So we have 4 supplements, it's actually 5. The last one is actually 2. So magnesium, again, one of my favorite things, because I think everything that we've talked about in a series so far, magnesium can help with a lot of these ailments,
Love me some mag.
So magnesium has been shown to help to reduce the frequency of migraines and the intensity of the migraine as well, too. It helps with improved blood flow to the brain. And we have a B vitamin here, riboflavin. All the B vitamins actually help with migraines, but specifically this one helps to prevent and reduce the frequency, help to prevent the attacks. CoQ10, we talked about this a little bit for heart health before. It actually helps to decrease the frequency of migraines as well, too. So this is another favorite of mine. And then we have these 2 herbs down the bottom, feverfew and butterbur. And they've been found in clinical studies to help to reduce the frequency and intensity of migraines. So a lot of my patients take those as just like kind of their daily supplements, just, anything that you could use. We talked about using multiple pharmacological drugs. Why not use multiple supplements that may be less of a side effect, etc., less of a stress on your body, basically.
And those 2 last supplements there, they're actually plant extracts, feverfew and butterbur, and they actually work really well to helping with vasodilation, increasing nitric oxide. They also help with reducing inflammation. Because I think feverfew, if I'm not mistaken, it helps with prostaglandins, and it does help to do that. And both butterbur and feverfew also help with neurotransmitter modulation too, whether it's serotonin or any of the others. It does, and all those combined can help reduce the frequency. Now, we can't eliminate the migraines, but if we can give you more headache-free days,
absolutely, I'll take that.
All the modalities that we mentioned, I think that's a win, right?
Absolutely. So, make sure you identify your triggers. That's a big one.
Big one.
And you have to be motivated to stop eating or drinking or exposing yourself to that trigger.
Doing the thing that causes the headache, stop it.
And, you know, just talking to your doctor about what may be good options for you, whether it be supplements or prescription medications, having that conversation, maybe seeing a neurologist if you need to, especially if you have migraines with auras, because the more intense that gets, it does put you at a higher risk for strokes later on. We absolutely don't want that.
No. And try not to manage it on your own. Like Dr. B said, please seek help if it's getting overwhelming, because even some of the stuff that we mentioned over the counter you can use, those can be detrimental to your system if overused.
Right.
They can lead to what we call rebound headaches, which are not fun. So figure out your triggers, get in front of a good healthcare professional, one that can actually help you navigate your headache journey. And hopefully this helped today. And I hope you picked up something new or refreshed your mind on something old.
Yeah. And hopefully the next time you have a headache, hopefully a little cup of coffee might help. You know, have Dr. G, a coffee snob over here.
Think of myself.
Definitely love his specialty coffees.
Yes. Thank you guys for joining us in the Vitality Vault. Hope to see you guys again soon. Bye-bye.
Take care now.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.